Music to the noise, yeah, the mess we make. Machine Pun Kelly get caught in the fake. Facts and logic with a twist of chest. Strip it down to truth, yeah, forget the rest. Humor pulls the lies right out of the park. Look beyond the shadows that set the dark. Sparks of laughter fire up the night, bringing clarity where they blur the fight. Cut through the chaos, yeah, the tangled lies. Machine Pun Kelly with a set of clear eyes. Truths and jokes gonna rock this show. Step into light where the real facts glow.
Poncho. I am just trying to figure out something here. Sorry. I want to talk today about the new developments with the shutdown and the health insurance issues that are going to be a byproduct of that. And I'm just saying, I'm really disappointed in those 8 senators that have decided that they're going to give Lucy a chance to be honest with the football for once. I don't know how stupid you can get. If they think that the Republicans are actually going to have good faith negotiations and have a vote where they're going to actually consider the ramifications of their votes, when they have been wanting to do what they're going to do since Obama ran on it in 1908 or in 2008. I mean, they've been against it from the beginning. They're not going to suddenly change their minds. So I want to talk a little bit about what Trump's idea is, why it's stupid, and how basically we are massively and truly screwed. I don't know how else to put this. And I don't care where you're at in terms of where you get your insurance, how you get your insurance. No matter who you are, you're screwed by this. And I just want to, as I was kind of doing some researching into this, I use AI to do some research, and I use Claude and I use Grok. And this is a quote from Grok. I asked Grok if I wanted to hurt the American healthcare system, would this be what I do? Or would I do this? And this is a direct quote from Grok. If someone sat down with the explicit goal of sabotaging American healthcare, driving up uninsured rates to pre-ACA, I'm sorry, I got the hiccups all of a sudden. Driving up uninsured rates to pre-ACA levels, bankrupting hospitals, especially rural ones, exploding premiums, bringing back pre-existing condition denials, and turning cancer chemo into a GoFundMe lottery, they'd copy Trump's 2025 playbook word for word. So even Grok called this, essentially sabotaging the entire U.S. healthcare system. Yeah, Linda says, name ACA Obamacare, Trump care, and he will sign the bill. There's probably some truth to that. the Class D Medicare. They've been wanting to get ever since Bush signed it into law. Democrats have been saying we want to be able to negotiate with drug companies. We want to be able to negotiate prices. Now Trump signs his name to it. It's called Trump RX, and they act like he came up with the idea when Democrats have been fighting for that for 18 years. But whatever. Nick says I should go to bed. I should. Anyway, so this is where we're at. I'm just gonna talk a little bit about what this all means. I'll start with, this is Trump's famous tweet. At least I thought I had it. Okay, hang on. I know it's on here somewhere. So, all right, let's try this again. All right. Oh, I see. It's showing us a, boy, it's just one of those days. When it rains, it pours. Okay. Try this one more time. There we go. All right. So this is the tweet or the post on his Truth Social. I am recommending to Senate Republicans that the hundreds of billions of dollars currently being sent to money sucking insurance companies in order to save the bad health care provided by Obamacare be sent directly to the people so that they can purchase their own much better health care and have money left over. In other words, take from the big bad insurance companies, give it to the people, and terminate per dollar spent the worst health care anywhere in the world, Obamacare. Unrelated, we must still terminate the filibuster. Okay. Well, ignore the filibuster part. This idea that Obamacare is the health care shows just how little he understands about anything. And we waited 10 years for this concept of a plan to be revealed, and this is the best he can do. So essentially, if you want to distill that down into actual policy, he wants to, instead of sending instead of supplementing ACA, he wants to send you checks. So like $5,000 a year has been floated. And then you can pay for your insurance with that, or pay for your health care or whatever. And the insurance, I'm sorry, 42 million losers on food stamps. I don't know what that has to do with the ACA. You can't actually be on, technically, you can't even be on receive ACA and SNAP benefits at the same time. You can't qualify for both. You have to be under 130% of the poverty line to get SNAP benefits, and you have to be over 130% to be on ACA. So I don't know what you're talking about, and apparently you don't either. All right, so what Trump wants to do is he wants to send you like a voucher, and then that voucher will pay for your insurance or whatever healthcare needs you have, and then the all right, so yeah, this I don't know what this guy. Anyway, I'm just gonna ignore him. So the he's gonna send you this money, this $5,000 a year, and then that's gonna pay for all your health care. Which, if you're just like young, you're 30, 25 years old, and like you eat healthy and work out and all of that, that's probably not gonna, that's a great deal for you. You're not gonna spend $5,000 a year on healthcare, and you have some money left over. And he's like, yeah, and if you got money left over, it's yours to spend. Well, if you don't have an ideal situation, you're probably not going to get that. And there's a lot going on that isn't being considered. So, first, let's go back to pre-ACA. This is, I think, what we need to think about. They have made it sound like the Affordable Care Act, somehow we had this great system. Everything was running smoothly. No prices were going up. Everything was just hunky-dory, super fine. And then Obama came along and just decided arbitrarily to socialize American medicine. And then the prices started soaring. And every bad thing that's ever gone is a direct result of the ACA or Obamacare. They get more angry if you call it Obamacare. That's not what happened. Before the Affordable Care Act, first of all, there was something called pre-existing conditions. And it kind of occurred to me that, it's been a while. It was 2009 that Obama got elected. So some people, and I think 2014 before it was fully implemented. So if you're like in your 20s or 30s, you may not even remember or know what it was like, back before Obamacare. But there was something called pre-existing conditions. And that meant if you had certain health conditions, then the insurance companies could either charge you more or just not cover you at all. And roughly 50% of Americans had pre-existing conditions, because these were not, serious conditions. Things like hypertension were included, but things like acne, if you had a history of acne, then they could charge you more money or not even cover you. And then, like if you didn't tell the whole truth, there was one lady that had a double mastectomy that was approved. And then they found out that she had had acne before and had acne medication. And so they denied her coverage for her double mastectomy because she lied about having had acne. Like somehow that's gonna thing. So we'll get to, so NV there says they can't charge, that this still exists and they can't charge you more. We'll get to that in a minute. Technically, they can charge you more, and I'll tell you how. And this is all to do with what Trump is doing. So the before we had these pre-existing conditions, and the part of the ACA was not, you couldn't charge more for pre-existing conditions, and you couldn't deny coverage for pre-existing conditions. But that was only if you were on the exchange. You could just not be on the exchange and just not offer the insurance. If it was going to be like a lose-lose thing, like you're not going to make money on it, you don't have to offer the coverage at all. And then you're not denying anybody coverage because you're not offering anybody coverage. And so what happened is they had some mechanisms in place to make sure that insurance companies wouldn't lose money in offering this insurance. One was, if you had, they had something called, hang on, what they called the 3 R's. The first thing was something called risk adjustment. Risk adjustment meant if you made, like if you had where you were only giving it to super healthy people. You were only offering, or like you're not you got super healthy people signing up, and so you made a bunch of money. And the other one would be you were taking higher risks, and so you were losing money. The people that made money because they were only accepting healthy people would offset the pay of those who were taking the higher risk people. And so as a result, everything balanced out. And this is something that, like, when you're talking about employment insurance, the reason that they can do it is they have what they call a risk pool, where it's spread out. So this person is high risk, this person is low risk. And the more you spread it out, the more you can mitigate the risk. So essentially that's what this is doing, is it's pooling all these insurance companies together, so pretty much everybody can make money, but you don't have to deny people coverage. The second thing they did is they had something called reinsurance. And reinsurance was the government insured you against high cost policy. So somebody has a $2 million policy, the insurance company would help cover the cost of that. So you basically couldn't lose money off of anybody. And the third thing they did was they had what they called risk corridors, this was like they were offering new stuff and or like these new kind of ideas and plans. And so these risk corridors, they were called because they didn't know exactly how much this was going to cost. And so the government said, we will compensate, we'll compensate your loss if you're undersold. Then Marco Rubio passed, a law saying it should be illegal and stuff. And eventually they went to court and he lost in court, but they didn't pay. And so those companies only got 10% of what they were supposed to get. And that ended up costing the insurance companies a bunch more money, which is why when that happened, there was a bump in premiums. So then, so there were these things that were offsetting other things. And so the insurance companies could enter into this market and give people with pre-existing condition coverage because there were things that were going to offset these risks. And when you take the insurance company out of the picture, then and the government's not working with the insurance companies anymore, there's no more incentive for them to be in the marketplace. So they can just not participate in this marketplace anymore. These conditions only applied if you're in the marketplace. I've got some people in the comment sections that are saying things that are just not true, so I'm just ignoring them. And like they can never deny, they could deny before ACA. I had coverage denied before the ACA. They absolutely could deny before the ACA. So then what happens is, so Trump says, okay, we're only going to fund, so we're only going to give you the money and then you can do with it. Well, the second thing that happens is insurance companies, actually, if you've ever been to Costco or Sam's Club, they buy in bulk. So you get things cheaper because they buy in bulk. Well, these insurance companies buy in bulk. They negotiate lower prices. If you ever saw your bill, if you ever look at a hospital bill, they'll have like an adjusted rate and an original rate. The original rate is what they officially charge. The adjusted rate is what the insurance companies negotiate things down to. So you're getting a special rate when you're on an insurance company. If you don't have an insurance plan, you're not getting that adjusted rate. You're paying the full price. So you go from, I think it's for an MRI, for instance, the adjusted rate, depending on your insurance company, might be $400 to $800. But if you're paying for it without insurance, you're paying $6,500 for that. So your $5,000 little cute voucher thing isn't even going to pay for one MRI. Now, if you don't need an MRI, you're fine. If you make one doctor's visit and just needed to get some penicillin for, a cold you had one time, and it's only going to cost you $200, you're fine with that. You made $4,800, but most people, that's not the condition. The other thing is you can just, these insurance companies can now deny coverage again by just not offering it or making it so high price that it's impossible to afford. So then what happens is you have something called a death spiral. All right. So this is what I'm talking about when I say a death spiral. This is right now where we're at. The next 5 years or the next 10 years, we're going to see a slight decline in enrollment, possibly, and a 63% increase in premium change, which, by the way, the inflation on insurance has been like cut in half by the ACA. People act like inflation didn't happen on insurance or premiums never went up before the ACA. They went up 300% from 2000 to 2009. They tripled. And it's going to be a lot worse now. Okay. So this is with subsidies. This is what happens without subsidies. Is you have the premiums go up, and the healthier you are, the more likely you are to just say, hey, I'm just going to keep the money. It's not worth it to me to spend all this money when I can, I got other stuff that I want to buy, right? So then those healthy people leave the risk pool. And as they leave, you're stuck with only sick people, which means that the sick people obviously need insurance more and use insurance more. So the cost to the insurance companies goes up. The cost to the insurance company goes up. That means the premiums go up every year. And you're not getting any supplement from the government now. And so this is all directly tied to you. So over the next 10 years, it's going to be about a 6,000% increase as this, what they call a death spiral, starts to happen. The healthy people leave, only sick people stay. As sick people stay, the sicker you are, the longer you try to stay in, and and then you start running out of money, and you start running out of people that can afford it. And so then, like you see the premiums going up as the number of people that are insured goes down. And then eventually where you end up with is a situation where there's just nothing available anymore, because the only people that they can cover are, so sick that the insurance companies just stop offering it on the marketplace at all. And you've had instances, there's cases in New York, there was a case in New Jersey before the ACA back in like the late 90s and early aughts where this actually happened. There are places here in since the ACA, there are certain counties and stuff where basically you just can't get insurance anymore because nobody's on it, because some red states have made it almost, have tried to make it harder to be on ACA and cover stuff. So you have less and less people on it, and then there's nothing there. So there's just no availability for people that don't have employer-backed insurance to buy it. It doesn't matter how much you want to spend. It doesn't matter how healthy or unhealthy you are. There's just nothing there. And so that's what you're going to end up with, a situation where people just don't even have the option to buy insurance unless it's through their employer. And then you've got, on top of that, this rise in AI and all of that stuff, where I think employer-backed insurance, employer-funded insurance, is going to become increasingly hard to get. People are relying more and more on gig work, on a gig economy, and gig work doesn't give you insurance, or they give you insurance that's extremely high, where your copay is really high, like $500 a month for an individual for a $15 an hour job, to where it's actually just as expensive as if you were on private insurance. The boy, there's just okay, yeah, this. So I don't know if some like right-wing person just, there's a bunch of weirdos slamming my YouTube comments here. So the what's going to then happen is, hang on, I'm just, all right, just turning away the comments. They're distracting. The insurance, sorry. So you end up with these death spirals where people just don't have the insurance anymore. And you're like, okay, I have a job, and that's fine. I'll just stick with employer-based insurance. Well, the employer-based insurance is going to go up too. In fact, there's estimates of around $28,000 copay on a family of 4 with employer-based insurance. That's not your own insurance. That's your copayment is $28,000 a year by 2034. And there are estimates that if, for instance, if you don't have that, your copay could be like 200, or your premiums could be like $200,000 if you're a family of 4 and the dad has hypertension. Like, and just insanely high prices. Insanely high premiums, to where private insurance is just going to basically not exist anymore. And even employer-based insurance is going to be extremely expensive. And then when you factor in, there's also going to be, with the return of pre-existing conditions, that long COVID is going to be one, and probably a history of COVID, because there's all these respiratory illnesses and everything that go along with just having had COVID. It's going to be just insane. This is not fixing anything, and nor is it saying that nothing needs to be fixed. But this is like trying to cure cure cancer by smoking. These solutions are not solutions. These solutions exacerbate the problems. Like the idea that you're going to be able to pay for your health care for just $5,000 a year is nuts. Or that everybody should, have the same healthcare costs a year. Or that the government should give a flat amount to every American to pay for their health insurance. Well, some people need more health care than others. And so you've got some people that are going to be dying, and you've got other people that are going to be getting, like just spending extra money. The estimates are that you're going to have roughly another 27 million people. When you combine the ACA cuts and the Medicaid cuts, you're going to have about another 27 million people that are uninsured. And then on top of that, you already have the 27 million that are already uninsured. So around 50 to 60 million people are going to be uninsured. And that's like 1 in 6 Americans won't have insurance. So they're still going to go to hospitals, right? They're going to go to emergency rooms, but they're going to go to emergency rooms because they're having heart attacks, and instead of going to the doctor to get blood pressure medicine. And so the estimates are for every million, right? I'm sorry. There's like one, well, I want to say this right. I think it's one estimated unnecessary death for every 100,000 uninsured people. So it ends up being like, well, it ends up being like 50,000 a year, however the math works out on that. It's one out of every 100 or one every 1,000. I forget. Anyway, there's about 50,000 estimated unnecessary deaths per year. So, over 10 years, of course, it's going to, go up gradually. But you're going to be talking about somewhere around 300,000 or 400,000 people that die unnecessarily over the next decade because of these changes in healthcare. These aren't just, they're not people that have done anything wrong. They're not people that are lazy. They're not people that aren't working. They're people that have a history of illness. And because they have a history of illness, they can't get health care, which is just totally upside down. No. We should only give health care to people that don't need it. It's dumb. The whole thing is just dumb. Yes, some people need more health care, and that costs more money. Why is it that we are the only country in the world that can't figure out how to get universal health care? You can say, oh, well, we have the best health care in the world. And in some ways we do. If you can afford it, we have, the best cars in the world, but people still walk because they can't afford cars. It doesn't matter how good it is if you don't have access to it. So when you've got what will end up being 1/6 of the country not having access to healthcare, it's kind of hard to say that we are leading the world in healthcare. And then another thing that's going to start happening, and it's already started happening, is that these insurance companies, like I didn't realize this until I was just looking it up today, but these insurance companies are now starting to own the hospitals. They're not just paying the hospitals, they're owning the hospitals. And we're going to see more and more consolidation of that. Where like United Health and Humana are going to start owning all the hospitals in the country. How do you like that? Do you think that, Trump is like, oh, these greedy insurance companies, they're going to suffer? No, they're going to be rewarded. Why do you think the Republicans have been taking all this lobby money from them for all these years? Why do you think that the Republicans don't want insurance, or don't want Affordable Care Act? Don't want what the insurance companies don't want, and do want what the insurance companies do want. You think they're not working for the insurance companies? Ha ha ha. They are doing exactly what the insurance companies want them to do. Because the insurance companies want to make money. They don't want to pay for people's health care. That's why they deny people coverage. They literally lose money every time they have to pay for coverage. They're not in it to pay for coverage. They fight to not pay for coverage. They try to make sure they don't have to cover people where they're going to have to pay for coverage. They want everybody that they cover to just never need health care, because it's just money that they get. Trump's sitting there acting like he's like standing up for the insurance companies by standing up to the insurance companies by giving insurance companies exactly what they want. So there are some things we can do about it, right? Like there are some ways that we can build on the ACA without, getting into Medicare for all, which personally I think that event like what we need to do is something like Medicare for all. I don't know if it has to be called Medicare for all or has to be exactly what Bernie Sanders planned, but some kind of universal healthcare system. I think we eventually need to get there. The mechanisms are a bit over my head. I know people that are a lot smarter than me that have some ideas. One thing we could do is restore the mandate and raise the fine for it. There was initially a mandate that was included in the ACA that you had to have insurance. And if you didn't have insurance, then you had to pay a fine. And it was like $50 a year or something trivial. And there was a lawsuit over, can you do this, and blah, 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 and so on and so forth. Eventually, the Supreme Court said, yes, this is fine. This is within the Constitution. It's a tax or whatever. I don't remember exactly what the decision was or why they decided it. But so then the Republicans, when they had the chance, they just stripped the fund. They just said, okay, the fine is $0 now. So there's no incentive to buy insurance. And the reason they wanted to do that is the healthier you are. So it's like, let's say you're perfectly healthy and, like you're just in your 20s and you're fine. And you never see the doctor. And so you don't pay for insurance. And then one day you get cancer. So then you go and you get insurance the moment you get cancer. And, and then you start paying. Well, again, like with risk pools, this is the healthy people and the unhealthy people are all together in this one pool. And so that's how the insurance companies manage risk. That's how employer-based insurance companies work. Is they're mitigating the risk because they have enough people that you have healthy people and unhealthy people together, and the healthy people offset the unhealthy people. Well, when you go private insurance like this, where the unhealthy people have to be paying, but the healthy people don't even get on until they're unhealthy, then they're not making any money. So one thing they could do is restore the mandate and put an actual fine on it to where it's, it's cheaper to buy insurance than pay the fine, like $1,000. So if you're like 25 years old and you can pay $50 a month for your insurance premium, and maybe the some of it's offset by the government and stuff, but you pay $600 a year to have insurance versus $1,000 a year to not have insurance. You're going to pay to have the insurance. Then that way the insurance companies have that money that they don't have to worry as much about paying out that risk, and then that lowers the cost for all the people that are unhealthy. So that's one thing you can do, is just restore the mandate. Another thing you can do is it's not just, we talk a lot about the ACA when it's just refer, like as though it just affects people that are self-employed or don't have employment-based insurance. But there's one aspect of the ACA that is, if you make less than 4 times the federal poverty level, which if you're a single person, that's about $60,000 a year. If you make less than 4 times the federal poverty level, you get some assistance from the government in paying your premiums. Okay. And it also has to be, they'll pay it down to 8.5% of your salary. So if you made $1,000 a month, just to make the math easy, if you make $1,000 a month, which hopefully you do, well, say $5,000 a month, then that would be 85 times 5, 400. And so, like, you couldn't pay more than $425 a month in your premium. Yeah, I'm saying then you would be about 6. So yeah, that'd be about right. So if you paid more than $450 for your premium and you were making $5,000 a month, the government would pay for that portion over the 500. If you were making $2,000 a month, then the government would pay more of it. Do you follow me? I hope I make sense here. But that is only applicable if you're paying for your, like for individual insurance. It's not applicable if you have employer-based insurance. So if your employer, if you're making $60,000 a year, $5,000 a month, but your insurance costs $500 a month, the government won't help you out with that at all. They won't pay that extra $50. So I think another thing we could do to help keep things under control is to extend that 8.5% benefit to people that have employer-based insurance, as well as people that have just individual insurance. So like those are just a couple of things that we could do to mitigate the cost of insurance. Like there's some things we can do to bring down the cost of ACA and to expand coverage so that more people have coverage without just gutting the ACA entirely. So well, we got some crazies here in the comment section. So what else? There was something else I wanted to say about all this. I think I also wanted to talk a little bit about, there are some things with the ACA that aren't good, but it's because of deliberate sabotage by the Republicans. Um, they've tried to repeal it over and over again, most famously when John McCain thumbed it down. But they tried to undermine the individual mandate, which that increased the number of people that were on it, which increased the pool, which is just what I was just talking about. That trying to undermine the individual mandate was deliberate sabotage of the ACA. And as a result, those people not paying into it means that your insurance premiums went up if you were paying into it, because you had less healthy people paying into it. Uh, they've done things like they've cut funding and outreach. They've tried to make make it harder for people to remember. Oh, this is the time to sign up. Go ahead and sign up now, and made it harder to sign up for it. There's also something that's like with junk insurance. Uh, they have these like short-term health plans or junk health plans that are basically scams, um and they don't follow the ACA consumer protections. Like there's a minimum standard of insurance that the ACA insisted on. And then, like Obama said, well, you can have whatever insurance you want. But he meant actual insurance. He didn't mean scam insurance. And so they like made a big deal about how he lied about that. But what they were offering wasn't really insurance. They didn't even meet the minimum standard to be called insurance. So it wasn't so much a lie as it was a lie about them calling it insurance when it wasn't. Now they're wanting to let enhanced subsidies apply. They keep filing these ridiculous lawsuits to undermine it. And they've been losing all these lawsuits too. Lindsey Graham calls it the biggest scam on the planet. Trump has called it the worst healthcare anywhere in the world, but there's no scam there. They don't get into specifics about what the scam is or what makes it bad. It's paying for the healthcare. It's not even healthcare. How can it be the worst healthcare anywhere in the world when the Affordable Care Act is nothing to do with actual healthcare? It's just to do with how you pay for it. And they cannot seem to come up with an alternative. Their best alternative is this ridiculous voucher program that doesn't even work in theory. They can't even present a cogent theory about how this is supposed to work. So we give you this $5,000 voucher, and you can't even pay for one MRI with that $5,000 voucher. How are you going to pay for leukemia with that? Your kid gets leukemia. Your 7-year-old daughter gets leukemia. How are you going to pay for that with your little $5,000 voucher? Oh, it's so cute. Your cute little $5,000 voucher. That's going to help your 7,000 or your 7-year-old daughter with leukemia? You can yell about Obama while your daughter dies. Or you can go into bankruptcy. The other thing that I forgot to mention is they had limits on how much you could, they had lifetime limits. Like you couldn't get more than like $2 million in insurance or $1 million in insurance over your whole lifetime. So you get like a 7-year-old kid with leukemia, that treatment right there can exhaust the lifetime supply or the lifetime cap for a kid, or while they're still a kid. So then that person, unless they get employer-based insurance, that person can never have health insurance again, can never get private health insurance because they've hit the cap. Lifetime doesn't mean lifetime with that company. It means lifetime period. Nobody else will pick you up. And you can sit there and you can talk about, oh, well, those things will still be protected. But how are they protected if there's no marketplace? Like you can't participate in the marketplace unless you follow these rules, right? But if you're not participating in the marketplace, how do you enforce those rules? What's the enforcement mechanism? The enforcement mechanism was you had to follow those rules in order to participate. And then they had other rules to make sure that you could participate and be profitable. And that's where the government supplements come in. You take out the government supplements, you take out the incentive for the insurance companies to participate in the marketplace. Then, if you take out the incentives to participate in the marketplace and you make it just that they're going to lose money, they're going to pull out of the marketplace. Then, once they pull out of the marketplace, where are you going to get your health insurance? How are you going to get your health insurance? And you've got more and more people that are losing their jobs or turning to gig work. And I mean, like, sure, like some of that, you think of gig work and you think of Uber drivers, but more and more, it's also like professional type work where, people are losing their jobs as writers or whatever. And now they're working as prompt writers and whatnot, where they're working with AI stuff or whatever, where it's like gig work though, you know. Well, they work somewhere for 3 months or 6 months, and they either have really bad employer-based health insurance or no employer-based health insurance at all. So that's where we're at. We're talking about 10 years from now. If Trump has his way, insurance is just going to become unaffordable for anybody that's a private citizen. You're not going to be able. I mean, you're talking, if you have high blood pressure, $200,000 a year for insurance premiums. If you a father of four, or a dad in a 4-person family with hypertension could end up paying $200,000 a year in premiums, which nobody can afford that, right? So insurance is just going to become a thing that you're not able to afford. We're going to see it's going to be worse than it was before the ACA. And it was terrible before the ACA. It was not this ideal, perfect situation. The Republicans want to make it sound like everything was just hunky dory, Jim Dandy fine, super keen cool until Obama came along and just ruined the healthcare industry. No, the Affordable Care Act is one of the most, if not the most important piece of legislation passed since LBJ. It has literally brought like 20, 30 million people, provided coverage for them. It's huge. It's huge what they've done. So anyway, I think that's all I've got for today. Brain's a little tired from looking at all this stuff today. I kind of want to go through some of these comments, but they're just, Like, just weird stuff. Democrats are trying to end child marriage. Guys, wake up. We're trying to end child marriage? Well, are you trying to begin child marriage? What is that even supposed to mean? We need to cut the SNAP and VA 100%. Yeah, screw those veterans. Anyway. Yeah, there's one I can get behind. Anyway. All right, that's it. Thanks for watching. Sorry for such a low energy show. But John Applegate, I agree. Some of this stuff with anyway, there's just, man, ignorance on these issues is so prevalent. All right, I'm going to be doing some videos, some explainer videos that you might want to, if you're not already subscribing, go ahead and hit the subscribe. There's going to be some explainer videos that'll be more coherent than my rambling on this topic during this show. But anyway, thanks for watching. I will talk to you tomorrow.